First Minister, are our hospitals safe?
Yes. That said, I fully understand the anxieties and the concerns that clinicians working at the front line of our health service have, and they are right to express those. The health service is under unprecedented pressure, greater pressure than perhaps at any time since its establishment decades ago.
And the Doctors' Union, just to be clear, has said that in their view hospitals are not safe right now.
Look, I'm not going to criticise frontline clinicians, nor am I going to criticise the organisations that represent them.
But you disagree?
Well, I think it's important to set out as a matter of fact that the vast majority of patients, thousands of patients literally every day, get high quality, excellent quality care in our National Health Service. What we see right now are some patients, too many patients, are waiting too long for some of that care. And I would not suggest for a second that that doesn't have consequences for some patients, which is why we are so focused on addressing the reasons for these delays.
But it's not just delay, is it? It's not just people waiting too long. Some of them are dying waiting.
Delays in accessing healthcare have consequences, and the consequences can involve harm for patients.
Including death.
I don't deny any of that, but the point I'm making is that that is why we are taking the action we are in these unprecedented times that are not just affecting the health service in Scotland, but affecting health services everywhere right now to address.
How can you say that hospitals are safe right now when the Royal College of Emergency Medicine estimates that perhaps 50 people a week are dying because they are waiting too long?
Well, look, I did a press briefing earlier on with the Deputy Chief Medical Officer, a clinician, not a politician, who said very clearly that if you need to be in hospital, and one of the challenges that we're all trying to address right now is ensuring there is care elsewhere for patients who don't really need to be in hospital. But if you need to be in hospital and if you need to be in an accident emergency, that is the right place and the safest place to be.
But are you sure, are you certain that 50 people a week are not dying because of these delays?
I'm not taking issue with the general premise of what the Royal College is saying. Their actual figure is an extrapolation of data, but I'm not disputing the general premise that if people are waiting too long for care, that has consequences. But what I am saying is, it's often asked of politicians, would you want a member of your own family to go to a hospital or A&E? If that's what the care they needed, then yes. The vast majority of people in A&E are getting speedy care and excellent care. Too many right now, because of the combination of pressures that our health service is facing, are waiting too long for treatment. And that is, as I was setting out at length this morning, what we're seeking to address, understanding what the cause of these delays is, and then targeting and directing action to deal with these delays.
Why did you not do more to make sure the NHS was in a better position to cope with these pressures?
I think we have planned for and prepared. So if you take delayed discharges right now, a difficult challenge for a long time for the health service, at a time when we might have expected over recent weeks to see delayed discharges rise, we've seen delayed discharges decrease.
But there are still 1,700 people in hospital right now who shouldn't be there.
Indeed, I was talking about that at length. The point I was making in response to your question is that it's not that we have not planned for and been taking action, but we are seeing...
But making it a little bit less worse is not the same as fixing the problem.
If I was sitting here suggesting that, then your question might have more legitimacy. I'm not suggesting that for a second. I'm trying to explain the context. So why did we not... We did plan for higher levels of flu this year, but we've seen levels of flu that have been above and beyond what was anticipated, not just in Scotland, but in many other countries. We're still seeing COVID present a challenge. So if you take the last week of last year, there were still 400 people with COVID admitted to hospital. In the last couple of weeks, in each of the last couple of weeks, we've seen 1,000 people admitted to hospital with flu. We've seen Strep A, for example, which has been a greater challenge than any health service would have anticipated a few months ago. So yes, we plan for these eventualities, but health services across the UK, across much of the world right now, are seeing these pressures even greater. And that's why we are focused on two things right now, trying as far as possible and as far as is appropriate to avoid unnecessary admissions to hospital and attendances at A&E. But secondly, and this goes to your question earlier, absolutely doing even more to reduce delayed discharges.
So how much money and how many beds are you going to buy with the new effort you're putting into that?
Again, I know one of your colleagues was at the briefing this morning, but I answered this question. I'm not putting a number on that right now because
will it wipe out the 1,700 bed blocking cases at the moment?
The thing, well, firstly, the point to understand, and this is a point that I think we all sometimes lose, that 1,700, which is slightly fewer than in the latter part of last year, it's not a static figure. Every day people are discharged from hospital. Actually, around 96% of all hospital patients are discharged on time. So every day people are discharged, but more people are admitted to hospital. We need to get that figure down in absolute terms, but it's not a static figure. In terms of the capacity, we are going to try to access as many care home beds as we possibly can. Hopefully that will be in the hundreds, and we'll provide additional funding to health and care partnerships.
And do you wish now that you'd done that before the winter crisis?
No, look, we need to respond to pressures as we plan as well as we can, and health services everywhere plan as well as they can. But when pressures exceed your expectations, then you need to adapt your planning. That is in the nature of government generally, and it's definitely in the nature of how we deal with the health service.
Do the BMA have a point when they suggest that the current model of healthcare provision is simply unsustainable?
I think I've got to be careful here that I'm not creating headlines that I don't want to create here. I think it depends what you mean by the current model. If you're talking about the model of healthcare free at the point of use, then no, I don't agree. I don't actually think that's what the BMA is saying. I am 100% committed to the model in that sense of the National Health Service. If you're talking about the model, the traditional models of care pathways, then yes, there needs to be change and reform. You look back, I was using this example this morning from a personal anecdote, but it could be multiplied many times. When my grandmother, more than 20 years ago, went into hospital for cataract surgery, she was in hospital for days. Now you're in and out of hospital for that kind of operation in a morning. So the way healthcare is delivered is changing. The ageing population, which is a thoroughly good thing, we need to support people to live longer, healthier.
Let me test another area. You've said that you don't personally have private healthcare provision. Would you consider going private if you or a close member of your family were kept waiting unduly long for a hip replacement, a knee replacement, or maybe something more serious?
Look, thankfully, I'm not in that position, but no, I don't envisage ever going private. I'm not going to speak
You'd rather wait in pain?
Look, I'm the First Minister. I want to have a health service where that doesn't happen, that people don't wait in pain. So luckily, fortunately, I'm not in the position of needing any of these procedures right now. So we're talking hypothetically.
If those who have the means went private to ease some of the pressure on the NHS?
My job, and it's a challenge that we are not meeting in every respect right now, and I candidly acknowledge that, but my job as First Minister is to work in government and with the health service to ensure that we've got a health service that meets the needs of everybody who requires healthcare. Now, we have a job to do to change the way healthcare is delivered so that fewer people do need to go to hospital because care is available in the community and closer to home. That's an ongoing process.
But shouldn't those who can afford to go private, wouldn't that help?
People will make their own. I am not going to sit here and advise people to go for private healthcare, no matter how many different ways you come up with to ask me that question. People, of course, are entitled, if they've got the means, to make their own decisions. But my job, my duty, my responsibility is to work to make sure that that is not necessary for anybody, that we have a health service that is delivering for patients.
Campbell talking to the First Minister, Nicola Sturgeon. There's that question over private healthcare.